Nail Diseases and Disorders, created by Regina Kreitz, KBI Online Nail Technician Course, November 9th, 2013. Healthy natural nails. Healthy natural nails will have a nice pink nail bed, healthy looking cuticles where there are no cracks or splinters, no cracks or splinters in the nails, and milky white color of the overflow. Corrugations of the nail. Corrugations in the nail can be caused by poor circulation, frostbite, aging, high fevers, pregnancy, and measles. This nail disorder is also known as Bowes lines or furrows, and mild cases can be treated by gently buffing to smooth them out. This is treatable. Transverse furrows. Transverse lines or grooves across the fingernails, transverse depressions in the nail plate caused by temporary cessation of cell division in the proximal nail matrix. The condition may be caused by local disease of the nail fold, physical trauma to it, or systemic insult, such as illness or a drug, also known as Bowes lines. If nail changes, such as depressions in the nail, are noted, it may be helpful to seek evaluation from a primary care provider or a dermatologist. Do not treat, refer to a physician. Onychosis. Onychosis is a health condition marked by thickening of the nails. It is observed both in nails of the fingers and the toes. The disease is more common in older people than young ones. Onychosis is also known as hypertrophy of the nail. The quickest and most popular method for treating this condition involves trimming the nails. Proper trimming will make the pain subside and provide space to nails to grow from the base. Frequently trimming can give a neat appearance to the nails and keep them in good shape. It will also remove the overgrown nail and make space for the new nail to grow from the base. Treatment of onychosis actually involves detecting the exact cause behind the condition. If the condition is found to result from disease, like diabetes or psoriasis, managing or curing the disorders can bring about an improvement in the nails. In extreme cases of onychosis, a partial or complete removal of the affected nail may be required. It is treatable but must seek medical advice to the source of the nail disease. Do not treat, refer to physician. Onychotrophia. Onychotrophia is considered to be one of the most severe yet common cases of nail infections because the nail eventually falls off from the finger or toe. You will know that you have the disease if your nails grow slowly. The edge of the nails cannot be seen clearly. It seems as though the end of the nails has grown into the flesh of the finger or toe. The nail, which is fully grown, first loses its shiny look and then shrinks before dropping off. Occasionally, the nail loses its shape and pus can grow beneath it. While most cases of onychotrophia are attributed to the nail matrix being damaged, onychotrophia can also be caused by injury and internal diseases. The causes of onychotrophia must be first determined to ascertain the treatment that would be effective and suitable for you. If the cause of onychotrophia is an internal disease, the disease must be first cured in order for subsequent treatment. Do not treat, refer to physician. Pterygium. Pterygium nail disorder is identified by scar tissue growing over the top of the nail bed, either partially bisecting the nail or completely growing over the whole section of the nail, possibly resulting in the loss of the nail. It can appear on both fingernails and toenails. Pterygium may affect one single nail or multiple nails on the body. Pterygium results from trauma to the nail, either from surgery or a deep cut of the nail, and the body's production of scar tissue to repair the trauma. Other causes of pterygium include malnutrition, reaction to chemotherapy, and iron deficiency. This disorder must be treated by a doctor. The skin growing forward is filled with blood and nerve endings, and if pushed back under the nail, may result in loss of blood and extreme pain. Do not treat, refer to physician. Onychophagy. Severe biting of the nails on the fingers and or toes. A tech can do a lot to aid a client who suffers from onychophagy, and it all begins with education. First, talk honestly with your client about the frustration and embarrassment nail biting causes her. Discuss her preferences for treatment. Does she want enhancements, or does she prefer to grow her own nails? If she chooses enhancements, be sure to apply them very short at the first appointment. Schedule a follow-up appointment for no later than 1 week. As her natural nails grow underneath, the enhancements will look more natural. If the client chooses to grow her natural nails, you may need to expand your salon supplies. The products used during a treatment manicure will be different from those used during a regular manicure, because they are chosen to repair skin and nails, not just to beautify them. Apply a nail polish formulated for nail biters, such as No Bite from Burrell or Stop from Mavala. Let the client know you're applying a foul-tasting polish so she isn't shocked when she puts her nails in her mouth. Apply a cream to the nail and cuticles that heals the damaged skin, not only one that simply smells nice. The point is for the product to seep into the skin and make the skin supple to prevent hangnails. Educate clients on how to care for their nails at home. Provide them with an at-home treatment package to purchase. The kit should include a file, a bottle of the polish you choose to prevent biting, and cuticle cream. Recommend the client apply the polish every other day. The cream should be applied as often as possible, even if that means carrying it to and from work to apply multiple times during the day. Take before and after pictures to add incentive to celebrate the client's achievements. Treatable but recommended to physician if problem persists. Eggshell nails. Eggshell nails are fragile, thin nails that curve over the tip of your finger. They are white in color and extremely delicate. Because they are so fragile, they are referred to as eggshell. It is important to be very careful when manicuring eggshell nails, as they tend to break very easily. Eggshell nails can be caused by the following: improper diet, medication, nervous disorder, internal disease, and stress. Some ways to cure or heal eggshell nails are to trim your nails, change and improve your diet to include all vitamins and nutrients that your body needs, or stop medications leading to eggshell nails. Use particular caution when manicuring your nails, exerting only slight pressure. If your nails tend to naturally curve or bend over the tips of your fingers, you could try wearing acrylics, artificial nails that are designed to strengthen the nail tip. Use a cuticle moisturizer, such as Sally Hansen's cuticle oil, to massage your nail tips daily. Wear gloves to perform household chores like washing, cleaning, and avoid detergents and soaps, which can make your nails more vulnerable to breakage. Trimming your nails, diet change, and restricting intake of medications can help your nails spring back to better health. If discontinuing medications is not a possibility, contact your doctor to see if there's anything they can do to help. Treatable, but refer to physician. Agnails, also known as hangnail. A hangnail is basically a small piece of torn cuticle that tends to be painful and annoying, especially when it rubs against your clothing. Oftentimes it becomes red and swollen. Hangnails usually develop during the winter months because of dryness. Apart from the dry, winter climate, there are certain other factors that contribute in causing this problem. For instance, hangnails can be caused when hands are exposed to excessive moisture, working in the water for a long time, or harsh chemicals like the ones present in detergents. In addition, nail biting tends to increase the chances of developing this condition as it causes damage to the cuticles. Bad manicures can also cause hangnails. When the nails are cut along the edge of the cuticles, at times manicures push back the cuticles too aggressively, thereby leading to hangnails. The most effective way to get rid of hangnails is to dip your fingers in warm water for about 5 to 10 minutes to soften and moisten the hangnail. You can also add a few drops of bath oil or olive oil in this warm water. Next, clip the hangnail with a pair of sharp and sterile cuticle scissors. Do not pull it out, just cut it at the base. To make the scissors sterile, clean them with a little alcohol. After clipping away the hangnail, you can apply an antibiotic ointment. Cover the area with a bandage if the hangnail was deep. Otherwise, just massage a hand lotion or vitamin E cream over the affected area 2 or 3 times in a day, especially after washing your hands. When dealing with infected hangnails, dip your fingers in warm water mixed with Epsom salt a few times a day to reduce the redness. Treatable. Onychorexis. Onychorexis is also known as brittle nails or brittle nail syndrome. Onychorexis is a nail disease. It makes the fingernail or toenail brittle and ultimately causes their breakage. The disease makes nails peel or break easily. Nails have a series of longitudinal ridges from this condition. Nails of the finger and toes are made up of layers of protein, which make the nails strong and thick. In people with this disease, protein layers separate or break down, leading to brittle nails. This nail disease mainly affects people who suffer from disorders with a deficiency of thyroid hormone production. Reduced thyroid production happens due to hyperactive thyroid gland. Bulimia. This condition affects young women who get depressed after eating in excess and feel guilty about not controlling their diet and keeping a check on their weight. Anorexia is another psychological disease in which the sufferer is obsessed with his or her body weight and has a delusion of being too fat despite being emaciated. Anemia. This disorder arises from the lack of red cells in the bloodstream. Nail polish removers. People who use too much nail polish remover are greatly susceptible. Soap water solution. Those who work too long hours with soap and water are also at risk from this disease. Psoriasis. This is a chronic skin ailment characterized by the appearance of red rashes over the skin surface. The patches are often seen to be covered with scales. Cold exposure. Prolonged exposure to cold, as during repeated hand washing or in chilling water, is also seen as a cause. Trauma or injury to the nails can also be a result. Repeated injuries to the nail are often seen to give rise to this condition. Malnutrition. Poor nutrition can affect the health and growth of nails and make them brittle. The medical treatment of onychorexis generally depends on the underlying condition. Doctors have to make an accurate diagnosis of the causative condition and work for its treatment. Treatment is supposed to vary with the nature of the disease behind the appearance of onychorexis. Once the condition is treated, the symptoms will also disappear in a short while, treatable in some cases. Onychoianosis. Blue nails caused by poor circulation or heart condition. Do not treat, refer to physician. Onychoptosis. A condition in which part or all of the nail sheds periodically and falls off the finger. It can affect one or more nails. It can occur during or after certain diseases of the body, such as syphilis, as a result of fever and system upsets. As a reaction to prescription drugs or as a result of trauma. Do not treat, refer to physician. Onycholysis. Onycholysis is the separation of a fingernail or toenail from its pink nail bed. The separation occurs gradually and is painless. The most common cause is trauma. Even slight trauma can be the cause when it happens repetitively. It can also be caused by manicure tools that are pushed beneath the nail to clear out dirt or smooth the nail. Too much moisture can also cause the problem. Some medical conditions can cause onycholycosis, generally by changing the nail's shape or the contour of the soft tissue bed beneath it. In these situations, the nail cannot attach smoothly to the nail bed. Fungal infections of the nails thicken the tissue immediately underneath the nail plate and cause the edge of the nail to lift. The skin condition psoriasis is also a common cause. After exposure to some medicines, the nail can react to sun exposure by lifting away from its bed. An overactive thyroid gland can also be a cause. Nails are slow to grow and take time to repair themselves. The portion of the nail that has separated from the skin surface beneath it will not reattach. Onycholysis only goes away after the new nail has replaced the affected area. It takes 4 to 6 months for a fingernail to fully regrow and twice as long for toenails. Some nail problems are difficult to cure and may affect the nail appearance permanently. Because the portion of the nail has lifted away from its bed, it may catch on edges when you move abruptly. It's a good idea to trim the nail close to the place where it separates from the nail bed. A physician can help you to do this. Do not treat, refer to physician. Tinea corposis. Tinea corposis is a skin infection due to fungi. It is also called ringworm of the body. Fungi are germs that can live on the dead tissues of the hair, nails, and outer skin layers. Tinea corposis is caused by mold-like fungi called dermatophytes. Ringworm often goes away within 4 weeks when using antifungal creams. The infection may spread to the feet, scalp, groin, or nails. It is also extremely contagious. Do not treat, refer to physician. Onychophema. Onychophema is the swelling of the hypertrophy of the and can be due to a number of causes, namely diabetes, mellitus, fungal infections, psoriasis, and eczema. It is commonly referred to as onychosis, and in some cases is hereditary. Do not treat, refer to physician. Paronychia, an infection that develops along the edge of the fingernail or toenail. It is the most common hand infection and, if left untreated, can progress to a more severe infection of the entire finger or toe. Do not treat, refer to physician. Leukonychia, also known as white nails or milk spots, a medical term for white discoloration appearing on the nails. It is harmless and most commonly caused by minor injuries that occur while the nail is growing. There is no effective treatment for leukonychia. The white marks and spots gradually disappears as the nail grows outward from the matrix with the nail plate. Do not treat. Onychographosis. Onychographosis is also known as ram's horn nail. It is a disorder that causes nails, usually toenails, to be thick and curved. It primarily affects elderly people and is thought to be passed on genetically. It is also caused by tight footwear and acute damage. The symptoms of onychographosis can cause discomfort when shoes or linen press thickened nails because the surface under the nail plate, is also thick and tender. So what pushes on the nail presses directly to the nail plate. Do not treat, refer to physician. Yellow nails. Yellow nail syndrome is characterized by marked thickening and yellow to yellow-green discoloration of the nails, often associated with system disease, most commonly lymphedema and compromised respiration. Nails that are yellow can be an indication of a medical disorder in some cases. These include liver disease, lung disease, diabetes, kidney disease, and nutritional deficiencies, most notably iron and zinc. Although most cases of yellow nail are not caused by an internal disorder, underlying medical problems should not be ruled out if your nails have suddenly changed in color. Simple blood tests can generally rule out most causes of yellow fingernail. Do not treat. Refer to physician. Hemorrhage nails. A splinter hemorrhage, also commonly known as fingernail hemorrhage, actually resembles a splinter underneath the nail. These small areas of bleeding or hemorrhaging underneath fingernails or toes often take the shape of straight lines. The nail bed contains many small blood vessels. Since the nail bed's anatomic structure is arranged in longitudinal grooves and ridges, when there is a small amount of bleeding within one of these grooves, the overlying nail plate traps the blood. The nail bed is linear in its construction, so the blood takes on the appearance of a straight line. Eventually, the small clots form and the bleeding stops. There is no pain or discomfort associated with splinter hemorrhages, other than the initial trauma that may have caused it, if that is the case. The only way you can tell you have a hemorrhage is by a visible small red stain under the nail plate. Treatment depends on the underlying cause of the splinter hemorrhage. But the only way to get rid of a splinter hemorrhage is to simply let it grow out. Since it is deposited on the undersurface of the nail plate, the splinter hemorrhage will grow out with the nail and the nail bed over a period of time and disappear completely. This usually takes a few months. Do not treat. Koilonychia. Koilonychia is a condition in which the fingernail becomes thin and finally lifts at the outer edges. This condition is also called spoon nails and is caused when there is reduced iron content in the blood. This disorder is inherited by birth, and there will be abnormal growth of the nail with thin edges. The nails will come concave shaped with raised edges looking very much like a spoon. This disease can be recognized if the color and shape of your toenails change. Even the condition of koilonychia will affect the density of the nails, making it thinner. Nail plates become thin and the nails completely come out of the nail bed easily. There can be pain if the nail gets fully detached off from the nail bed. Presence of secondary infection will be there, changing the color of the nail and bottom surface. Do not treat, refer to physician.